Now we're going to do the submental region, and so this is an area that is treated very effectively with threads. Now if you have a patient with a lot of fatty tissue in this area, I would encourage you to consider dissolving that first with one of your agents, whether you're going to use a mesotherapy like a PCDC that you would get from a compounding pharmacy, or if you want to use Kybella, which is the FDA approved product that's available from Allergan. And we do have classes on Empire for both, for Kybella and mesotherapy, that you can learn how to effectively dissolve any fatty tissue in this region. She doesn't have a lot, but she does have some skin laxity here. And so we're going to treat this with our 29 gauge, 25 millimeter monofilament threads. I'll show you guys a mesh technique that I like that really tightens this area up nicely. One treatment will give the patient a good result, but for best results, I usually have them come back about 6 weeks later and we do a subsequent treatment. Again, with any of the threads or biostimulant fillers, we really want to be cautious with our aseptic technique. That's obviously important with any of the injectables that we're doing because we are injecting into patients' faces, but especially so when we're putting products that are going to take a while to dissolve. So we're cleansing with chlorhexidine, and then we're going to place our threads. This is our 29 gauge, 25 millimeter monofilament threads. They are on a sharp needle. So with this, it's going to be one stick. The patient has had topical benzocaine, lidocaine, and tetracaine on prior to this procedure, but they still may feel a little bit of a pinch. Okay, here we go. 1, 2, 3. I leave the threads in place until the very end as a marker so I can see where I've already been with my treatment. 1, 2, 3. Little poke. 1, 2, 3. The neck is an area that is prone to bruising. There are a lot of small little vessels there, so we do want to watch for that and try our best to avoid any of the small vessels that we see to minimize the chance of bruising in the patient. 1, 2, 3. This is a treatment that's really nice for the neck. You can actually go all the way down the neck. You can put this in any of those fine lines or wrinkles that they have in the lower portion of the neck. We're doing this today is more of a tightening treatment. Now, when we move to the other side, one of the things that you'll have to be aware of is that as you place your threads, you can hit the needle from your other side. So sometimes you'll see that move and we'll adjust. We're going to try to go between these and make a mesh. Okay, 1, 2, 3. But you'll see as I'm placing that, it does move some of those a little bit. That's okay. Now, this is a technique that I do in my office very frequently with great results. My patients really love the tightening effect they get, but there are alternative ways to do this. We'll show you guys some photos where we can do this in a half moon shape. You can put different patterns in there. We can actually go in now and cross these threads in an opposite direction. But the key is to get our PDO thread material into the area that we want to stimulate collagen and tighten the skin. So however we can most effectively get those threads into that area, a little bit of this is going to be practitioner preference, and a lot of it's going to be figuring how to get the most bang for your buck. And so I find that in my office, this mesh technique where I come in from each side, I get a very good result. I get a nice tightening of that area, and so this is what I use most commonly. So with our monofilament threads, we do want to make certain that they are all the way in and that our buoy is up to the hub of the needle, so that way we don't have extrusion of the threads after the procedure. We are going to twist each of these threads, and as we do that, we'll then remove them. Always have a gauze ready in case there is some bleeding or bruising, so we can put pressure right away. We can remove a couple at a time. And same thing on this side. We want to do a little twisting on each of them. And then we'll just remove them. And the patient will start to see results in this area within about 4 to 6 weeks.